So the purpose of early intervention orthodontics, it is for really two main things. One, it's to modify the structure of the jaws, to identify issues with the jaws. So really, before we get into the age where we have the traditional braces on to move teeth around. This is before we're even thinking about moving teeth to get the final positions. This is to get the framework correct. For example, if we have an upper jaw that's not developing properly, it's very narrow, there's potential for crowding, as well as functional issues like a crossbite where these upper teeth are actually kind of on the inside, the incorrect position of the lower teeth. One of the really big things we do is expand. We use an orthopedic brace, which can expand and develop the upper jaw. So it does two things. It develops the jaw so it fits with the lower jaw so that we have the function that we want later in life, the proper bite. But what it also does is make more space on that jaw so that we can avoid having to take adult teeth out later. I mean, that's just one example of many things with early intervention orthodontics. So really, it's an orthopedic approach to developing jaws, top and bottom jaws, in order to make the framework for all the teeth to fit and to get the best smile without any compromise on function and long-term health of the teeth and mouth. That's it in a nutshell. And on the other big side of early intervention orthodontics is when we can maybe identify issues with teeth still developing in the jaws that we won't be able to see without maybe certain types of X-ray. We can identify little local issues with teeth trying to grow in that may potentially become impacted, stuck. And there are things, quite simple measures that we can have done at that particular stage, which then gets these teeth out of these little local issues and allow the teeth to grow into the mouth as they should. Early intervention orthodontics can minimize the need for braces later, or when braces are used, it can make the treatment a lot more simple and a lot less invasive. For example, not needing to extract teeth. It's rare that it can completely negate the need for braces. Again, I need to emphasize that early intervention orthodontics really isn't about moving the teeth into the final correct positions. It's about creating the framework for teeth to grow in as best they can naturally. But there are the rare cases where we do the early intervention orthodontics and braces are not required later, but they are normally required at least for some simple tooth correction later on. The best candidates for the early intervention are 8-9-year-old boys and girls, basically. So I want to assess them around that age. Often the first kind of the earliest age I see patients is around 7 years old. So we can even at that age I can identify if some potential issues are going to start. Typically, if I am going to do early interventional orthodontics, it's around 8.5 years old. The treatments and procedures offered as part of early intervention orthodontics is often orthopedic braces, so upper expander braces that develop the upper jaw, or a lower orthopedic brace to develop the lower jaw, develop the mandible, forward. These are sometimes known as functional braces. The kind that I use are usually quite simple and streamlined, and just attached to the very back teeth. There's not much on display, and often patients get on with these and wear them 24 hours a day without any kind of intrusion on their daily life. So sometimes early intervention orthodontic procedures is as simple as having 1 or 2 baby teeth removed at the right time to encourage the adult teeth to grow in the correct path. This is it's hard to say because some tooth development can vary so much, but yeah, I would probably rarely treat anyone below the age of 7. And a typical age that I would start the kind of the earliest treatment or procedures is around 8 years old.